Bariatric surgeries at Tucson Medical Center are performed inside TMC's orthopedic and surgical tower. Valet parking is available outside of the tower. Volunteers are at the concierge desk just as you walk in for any questions you may have. Please take the elevator to the second floor. You'll check in at the desk first and then with a volunteer who will give you a paper that has a unique identifying number on it. Your family or friends who are with you can track your progress using the monitors in the lobby. You will shortly be taken back to pre-op where your nurse will go over a few things. Patient Debbie Contreras shares her perspective.
What I remember most about that was that it happened so fast. It was like, okay, here's your gown, here's your slip booties, here's all this stuff, go ahead and get in bed. The gowns, you know, you go to the doctor's office and it's one size fits all and everything's hanging out. And here they had perfect gowns. It was purple, which is my favorite color. And then it was, you know, it just fit, even as big as I was. They knew by my weight what size to use and everything, so you don't have to worry about hanging out or doing anything like that here, which is one of the things that makes you feel comfortable.
Your nurse will let you know when it's okay for a loved one from the lobby to come back and join you. You'll then meet the other members of your surgical team, including your anesthesiologist. An IV will be started. You'll likely be given some medicine to help you relax. As you are wheeled to surgery, we ask that the person with you please head back to the lobby. Restrooms are conveniently located near the elevator. On the first floor, higher grounds, a coffee shop with grab-and-go food items is next to the concierge desk. Please ask a TMC volunteer for directions to the cafeteria. Most bariatric surgeries take between 30 minutes and 4 hours. Talk to your doctor about what to expect with your surgery. After your procedure, you will be wheeled to the post-anesthesia care unit or PACU. A nurse will be by your side as you wake up from anesthesia.
I was cold in there. They brought me warm blankets. I was very, very groggy. I don't remember much, just that I was cold. I had the oxygen tube that went around the ears. Your throat is very sore and your mouth is so dry, and they don't want you to have any fluids right away. Ice cubes, I was begging for ice cubes or a swab or anything because you can't have anything right after bariatric surgery. They got a hold of Dr. Monash and he said that I could have swabs, which was like eating a vanilla ice cream cone. I mean, it was like the greatest thing, you know. So once I got the swabs, I was fine.
During that time, your surgeon will meet with your family in the lobby. Patients will stay in the PACU for about an hour. A TMC volunteer will tell your family which room on Unit 700 or 800 has been assigned to you just as soon as it becomes available. As you are wheeled to your room, staff will let your loved ones know that they may walk beside you. It is about a 7 to 10 minute walk across the hospital.
They're very family conscious. They make sure that your family is there whenever they can be there. And that made me really happy, because that's the smiling face you want to see when you wake up.
At some point, your loved one may want to move their vehicle to the northeast entrance.
This is a very big hospital, oh my goodness. And I'm telling you, it's like a maze. Getting familiar with the hospital prior to surgery is probably one of the things that you should do.
Your nurse will meet you in your room. A bit later, the patient navigator will come in.
I just was tired. I was exhausted. I was just groggy. And I was pretty much out of it. I was, you know, they give you pain medication and all this other stuff. And so you don't really feel anything. I did have pain that night. Like I said, once it came in, it was pretty fierce. And all the way through the next morning, there was pain. Believe me, it was you could tell somebody had been in there and working.
Your nurse will work with you to keep your pain under control. All patients will get out of bed and walk the same day, typically within 4 hours of arriving on the unit. This is done to try and prevent blood clots from forming in your legs or lungs.
The sooner you get up, the sooner you'll heal. Okay, the one thing that they're worried about is blood clots in your legs, so they put these things on your legs that air goes in and out of to kind of keep your blood circulating.
You will not be allowed to eat or drink anything until you are seen by your surgeon the next morning. Most patients will be discharged on that day.
My time here was amazing. Everybody took care of me, and I'm one of the success stories.